abnormality in the cusp itself, making it so the valve doesn't want to open. And as we'll soon see, this is usually a chronic process. Valvular insufficiency, on the other hand, can be a problem with the valve or the supporting structures around it stretching it open, allowing blood to regurgitate backwards. This can be pretty abrupt, too. Remember the sudden regurg that occurs when a heart attack ruptures that papillary muscle. Most of the high-yield stuff to know on test day, by the way, takes place on the left side of the heart, the side responsible for sending blood from your lungs to the systemic circulation. So, the main focus of this chapter will be bicuspid and aortic valve pathologies. First up is the bicuspid valve, also called mitral valve because it resembles a Pope's mitre hat, with those two pokey things on top. In this scene, however, instead of a mitre, we're going to incorporate that classic bicuspid shape into a chef's hat. A ton of diseases can cause either acute or chronic mitral regurgitation, but we'll save most of those for our next sketch. In this scene, we're going to focus on stenosis. And luckily, there's pretty much only one acquired cause of mitral stenosis that you need to know, and that's rheumatic fever, an acute multisystem inflammatory disease that sometimes follows a group A streptococcal infection. Remember group A strep from Sketchy Micro? Its other name is strep pyogenes, embodied, as always, by that deliciously flaky Pyogenes pie. And in case you haven't guessed already, it's a strawberry rhubarb pie. That's rhubarb for rheumatic fever. Now, group A strep can cause a vast array of infections: cellulitis, glomerulonephritis, pneumonia, all kinds of stuff. See that red handkerchief tied around his neck, though? It's there to remind you of streptococcal pharyngitis specifically. That means strep throat. You have to have a preceding streptococcal pharyngeal infection before you can get rheumatic fever. It's not entirely clear why, but the strains of group A strep that are able to colonize and cause infection in the pharynx are pretty much the only strains that are also able to trigger acute rheumatic fever. Clear why, but the strains of group A strep that are able to colonize and cause infection in the pharynx are pretty much the only strains that are also able to trigger acute rheumatic fever. In the US and other developed countries, we test for strep a lot. We can even use a rapid strep test to swab the back of the throat and identify strep antigen in about 15 minutes. And you know how it is. Antibiotics are like candy over here, so strep is often treated appropriately. In the US, strep pharyngitis rarely progresses to rheumatic fever. It's a much different story in developing regions of the world, however, where the incidence of acute rheumatic fever is substantially higher. It's thought that this is largely due to environmental factors, such as household overcrowding, which favors increased transmission of group A strep. In fact, severe disease caused by this nasty bug affects over 33 million people worldwide. And rheumatic fever is the leading cause of cardiovascular death during the first 5 decades of life. Yep, this cupcake shop definitely caters to the younger crowd. Though it can occur at any age, most cases of rheumatic fever occur in children who are between 5 to 15 years old. The classic test question will start out with a 10-year-old boy with fever, chills, and rash, and, to top it all off, a sore throat. On exam, you notice a bright red tongue along with little exudates on his tonsils. That just might be strep throat, my friends. And if that sore throat isn't immediately treated with antibiotics, about 1 in every 100 kids will progress to rheumatic fever. But hold on a sec. See the chef marking the calendar for a delivery of cupcakes due a few weeks from now? Before the first signs of acute rheumatic fever appear, there's actually a latency period of about 2 to 3 weeks following that initial episode of pharyngitis. And then, all of a sudden, you're dealing with arthritis and rash and myocarditis. It's bad. Here's the thing, though. It's not like during that 3 weeks the bacteria had time to swim around and invade your joints and heart and have a party. The bacteria actually don't even make it past the pharynx. Instead, it's your own immune system that's attacking you. Antigen-presenting cells show the bacteria to T cells. T cells tell the B cells what's up, and all of a sudden, you've got enraged B cells sending out IgG and IgM antibodies against your own tissues. Just think of this immunoglobulin-evoking pair of tongs latching onto something like your heart instead of bacteria. And I know we've only represented B cell antibodies here, but both B cells and infiltrating T cells are involved in the attack. This cross-reactive immune response is thought to be mediated by molecular mimicry. In other words, some streptococcal bacteria have special M proteins that look just like human proteins. Part of the M protein, for example, resembles the myosin found in heart tissue, so antibodies and T cells are directed to attack the heart. Just remember M for mimicry, the sincerest form of flattery. Hey guys, look at me. I went to culinary school, and now I work for minimum wage at a cupcake chain store while trying to pay off years of student debt. Yay! Kids these days. So dang cute. Whoa, holy crap, look at that decorating job. Almost looks like you spelled something. In cupcake. The most delicious of writing languages. Let's see here. Hones? Cajones? Jones. That's it. The Jones criteria are used to diagnose acute rheumatic fever. It involves 5 major criteria and 4 minor criteria. The minor criteria are pretty nonspecific, like arthralgias, fevers, ESR, prolonged PR interval. Not as exciting. It's the major criteria that we've spelled out on the cupcakes. Just remember the letters in the word Jones. This line brought to you by the letter J. J is for joints. Just kidding though, J is for joints. See the frosting all over the chef's elbow? Migratory polyarthritis is the most common initial presentation in acute rheumatic fever, occurring in about 75% of cases. It's migratory, so it usually involves multiple joints in quick succession. Usually the large joints, like elbows, knees, ankles, and wrists. Luckily, there's no permanent joint damage. Just wipe that frosting off, and the elbow is just fine. The heart-shaped O on the next cupcake represents carditis, but we'll get into that in just a little bit. The N in Jones is for nodules, kind of like the nodular little candies decorating the cupcake. See how they're falling onto the inside of that outstretched arm? These subcutaneous nodules are found on the extensor surfaces of the forearms. They show up in about 10% of cases, and are very similar to those seen in rheumatoid arthritis. The E stands for erythema marginatum, which sounds much more Latin and much worse than it really is. It basically consists of non-pruritic circular rings or C-shaped areas of erythema on the skin. This is not cellulitis, an important distinction, because strep pyogenes can cause cellulitis with other infections. And finally, the S, which stands for Sydenham chorea. See how that S cupcake is involuntarily sent shaking to the floor? Sydenham chorea is characterized by rapid involuntary choreiform movements, sometimes more prominent on one side of the body. It can involve emotional disturbances as well. This syndrome only occurs in about 10% of cases and can actually have a pretty long latency period, showing up 1 to 8 months after that initial pharyngitis episode. Let's get back to that O, which represents carditis, because there is a lot going on there. All right, a fresh baked batch of heart-shaped cookies right out of the oven, just like Mom used to make. Except that these are blazing hot and represent the pancarditis that occurs in the setting of acute rheumatic fever. You got that right, heart cookies in a pan for pancarditis. That means it involves the pericardium, epicardium, myocardium, and endocardium, all the layers. We've illustrated the pericardium over here. It's the case that the heart sits in, and in this scene, it's the heart-shaped case that carries the various tips for the pastry bag. The classic signs and symptoms of pericarditis are interior chest pain relieved by leaning forward and the friction rub on auscultation. The pericardium will likely exhibit a fibrinous exudate, but it usually resolves. Move inward one layer, and now we're talking about inflammation of the myocardium itself. That's myocarditis, and it's sketchy. That means a flaming heart. This is the scariest part, because it's the most common cause of death in acute rheumatic fever. An angry, inflamed, and dysfunctional myocardium can lead to heart failure, even without overt valvular disease. I mean, just look up. Yup, it's our recurring floppy failing heart balloon, coming in to ruin the party, as usual. Remember, heart failure is not supposed to happen in a young person, but in acute rheumatic fever, myocarditis can precipitate acute heart failure. That means pulmonary and peripheral edema, tachycardia, and hypotension. Not good. What happens when we zoom way in on this inflamed myocardium? Well, myocardial biopsy will show a kind of normal-ish looking heart muscle, but it will be interspersed with discrete regions of interstitial fibrosis. Inside these little fibrotic areas will be lymphocytes and macrophages clumped together, doing that inflammatory thing that they do. That's what I call a granuloma. At Sketchy, macrophages are represented by cages, macrocages, if you will. A granuloma, therefore, which consists of a group of activated macrophages, is depicted as a bunch of cages, just like the ones in the back there, protecting those cupcakes. Some of these macrophages will even transform into multinucleated giant cells, hence the multiple levels of purple staining cupcakes contained inside. These characteristic granulomas scattered within the interstitial connective tissue are pathognomonic for rheumatic fever and are called Ascough bodies. Ascough? More like hands off. In acute rheumatic fever, Ascough bodies can be found in any layer of the heart, the pericardium, myocardium, or endocardium. That's pancarditis for ya. Some of these activated macrophages that we've been talking about get a little too plump. These special cells, called Nitschkow cells, have abundant cytoplasm and squish nuclei that resemble a slender ribbon of chromatin. That wavy ribbon-like appearance is why these cells are also called caterpillar cells. Cute, right? Alright, let's go down one more layer, to the endocardium. See the flame inside that oven? If a flaming heart is myocarditis, then a flame coming from within a heart is endocarditis. That innermost layer, by the way, also forms the cardiac valves. Yup, endocarditis might just include some valvulitis. Okay, this is what happens when you hire from Craigslist. Look at this guy. He seems to be decorating his hat instead of, well, I don't know, not his hat. Are we paying this guy? I'll give him this, though. That is a perfect representation of what happens to the mitral valve in acute rheumatic fever. Endocarditis causes fibrinoid necrosis and fibrin deposition on the surface of valves. This shows up as little sterile verrucous vegetations along the line of the leaflet closure. See? Right on that central rim there, where the cusps normally close. The mitral valve is affected most commonly, hence the bicuspid hat, though the aortic and tricuspid valves can be involved as well. You just, keep up the great work there, Braden. Alright, needless to say, valvulitis leads to valve damage. Again, we've prominently featured that bicuspid hat throughout this sketch because it's the mitral valve that's most commonly affected, and, as you can see, it can get all floppy and regurgy. So as he squeezes that frosting in his mouth and lets it regurge all over his face, imagine blood regurgitating backwards through an incompetent mitral valve during every systolic squeeze. That will most likely mean your patient will present with a new murmur. Hear that? Mitral regurgitation is usually heard as a harsh systolic murmur over the apex and radiating to the left axilla, right to where that frosting is radiating. This is a classic finding that shows up on the test. They'll tell you about a 10-year-old boy rushed to the ER with shortness of breath, fever, fatigue. Okay, some kind of flu thing, maybe. Then they'll say that he has tachypnea, tachycardia, and hypotension. Okay, he's got some diminished cardiac output. Not good. And on cardiac auscultation, the patient has a new hollow systolic murmur. Ding, 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 ding. A new systolic murmur in a young kid with heart failure? Think of acute mitral regurg due to acute rheumatic fever. At Sketchy, whenever we want to highlight an event that takes place during systole, such as a systolic murmur, just look for that systolic spray. Valvulitis can also affect the aortic valve, leading to aortic insufficiency. This is less common than mitral regurg, however, so we'll just run through it quickly. At Sketchy, the aorta is represented by a conical princess hat. So as that frosting regurges out of this young princess's mouth, imagine incompetent aortic leaflets letting blood dump backwards after every beat. This is heard as a diastolic murmur instead of systolic, hence our recurring diastolic diamonds decorating her outfit. And that's it for carditis, the O in Jones. Even when using the Jones criteria to assess systemic symptoms, the diagnosis of acute rheumatic fever can be a bit tricky. Remember, the rheumatic symptoms appear weeks after that initial pharyngeal infection, so you won't be able to culture any group A strep. This is your own immune system doing damage here. So instead, we can look at what kind of antibodies your body is making. See those antibody-esque tongs? Specifically, we can detect anti-streptolysin O titers, embodied by those delicious round donuts, and anti-DNase B, represented by that somewhat less enticing twisty DNA bread. In our strep pyogeny sketchy micro video, we cover these serum markers in a bit more detail, so be sure to check out that sketch as well. You can only prevent rheumatic fever. You can't really treat it, though anti-inflammatory agents can be used to decrease arthritis symptoms. Prevention of acute rheumatic fever involves the prompt treatment of that initial group A strep pharyngitis, usually with a penicillin, hence our recurring purple penicillin pencil next to that red pharyngeal necktie. Okay, let's say your patient does get rheumatic fever, jumps through all those Jones criteria hoops, but the symptoms subside and she's back to normal. No harm done, right? Well, not exactly. The next time she gets strep throat, she's much more likely to progress to rheumatic fever yet again. The immune system has a great memory, and those same B cells and T cells are just waiting to get unleashed. Not only that, with each new episode, the symptoms are even more severe, and the damage to the heart can be cumulative. This is depicted by those recurring bacterial lanterns. With each subsequent infection, the damage accumulates. Progressive valvular disease can develop in the years following one or more episodes of acute rheumatic fever. That's right. A patient who, maybe once in their childhood, suffered from strep throat and acute rheumatic fever will present to your office years later with new cardiac symptoms. We're talking slow, chronic changes to that mitral valve that was initially damaged a long time ago. At Sketchy, chronic disease is represented by a chronically aged grandfather clock. Yep, it's time to shift our focus from acute rheumatic fever to chronic rheumatic heart disease. Remember those Ascough granulomas we mentioned earlier? Well, when they heal, they can leave behind fibrous scar tissue in the mitral valve. Over years, the mitral valve continues to thicken and get all gross looking. This usually leads to a chronic mitral stenosis. See how the chef here squeezes down on that mitral hat? He's worked all year to perfect that cupcake recipe, and he's about to witness the first taste test. So, while acute onset of mitral regurg is one of the hallmarks of acute rheumatic fever, mitral stenosis is a sign of a chronically scarred valve, as is seen in chronic rheumatic heart disease. Regurg can occur at this late stage, but stenosis tends to predominate. So we'll focus on mitral stenosis in this sketch. The aortic valve may also show chronic scarring, leading to aortic stenosis. Again, it's that stenotic mitral valve that you'll see most often in the setting of chronic rheumatic heart disease. So the rest of our sketch is dedicated to the clinical presentation of mitral stenosis. Alright, before our first customer gets to try the cupcake, take a look at her friend in the back. Yeah, that's her up on the pony there. What, you didn't have one of those when you were little? that you'd just cavalierly ride into cupcake shops with no regard for health codes. Anyways, she's also really nervous because her friend is known to throw quite the temper tantrum when a cupcake doesn't meet her high standards. As she anxiously squeezes on that heart balloon, notice that left atrium bulging out. In the setting of mitral stenosis, that left atrium has to pump blood through a tiny stenotic opening. Pressure builds up and the atrium dilates. A dilated atrium doesn't like to conduct properly, so say hello to atrial fibrillation. At Sketchy, we always represent that classic irregularly irregular AFib heartbeat with a TV screen displaying an irregularly irregular signal of static. We're not done yet, because a dilated atrium that's fibrillating and not really moving blood properly is the perfect place for a mural thrombus to develop. See those chocolate cupcakes splattered on the wall? Yeah, those were the last few cupcakes she tried. Looks like a few negative reviews so far. Let them remind you of the mural thrombi that can develop whenever there's abnormal blood stasis inside a heart chamber. And as her friend cowers in fear, notice those chocolate drips hitting his head, just like little emboli breaking off and causing a ischemic stroke. If that left atrium dilates enough, it can actually compress the recurrent laryngeal nerve that courses next to it. The recurrent laryngeal nerve loops up towards the larynx along each side of the trachea, kind of like these two reins here, looping up on each side of the horse's neck. Impingement of the left recurrent laryngeal nerve will lead to a hoarse voice. Hoarse voice? Hoarse? Oh, you get it. Sorry. Whoa, easy on those reins there. Because a dilated left atrium can also press right on that esophagus and cause dysphagia. And I don't know if you noticed, but the stenotic mitral chef over there is looking uncomfortably sweaty, just abnormally moist. And the front of his apron now has a couple of edematous lung spots. This should remind you of pulmonary edema. You see, as that left atrial pressure rises, blood backs up into the pulmonary system, and before you know it, you start to see symptoms just like those seen in left-sided congestive heart failure. The murmur of mitral stenosis is pretty characteristic, and the features are depicted by our cupcake princess over here. First, notice the garish diastolic diamonds she's wearing. They're here to remind you that the murmur of mitral stenosis is diastolic and occurs with ventricular filling and atrial kick. Hear that? It's often described as a rumbling murmur, just like the rumbly tumblies emitted from her empty stomach. The most characteristic feature, however, is the opening snap. See the impatient snap she uses to demand service? Sometimes the valve leaflets are so stenotic that it takes an excessive amount of pressure from the left atrium to pop them open. This can actually be auscultated on physical exam. Typically, there will be an opening snap when the calcified valves finally open, followed by a mid-diastolic rumbling murmur. It's best heard over the apex or the left sternal border. Also, take a look at those two sisters cowering in front of Miss Fancy Pants. At Sketchy, we call them the S2 sisters. It turns out that the relationship between S2 and the opening snap can actually be used to estimate the severity of mitral stenosis. The snap is heard during diastole, right? Which means it comes after S2. Well, when lots of pressure builds up behind that stenotic valve, it opens sooner in diastole. In other words, the closer the snap is to S2, the more severe the stenosis. Just think of these S2 sisters clinging tightly to Miss Snappy's side whenever her mood is severe. Alright, so chronic rheumatic heart disease is the most common cause of mitral stenosis, but it's not the only cause. You know what else goes with cupcakes and cookies and subcutaneous nodules? An ice-cold glass of milk, of course. Mitral stenosis can also be caused by a chronic degenerative process called annular calcification. It's actually quite common in older adults. The disorder involves the formation of degenerative calcific deposits in the fibrous ring of the mitral valve. Kind of like the ring of milk around the mouth of grandma here. It's generally an incidental finding associated with aging, and will most likely not cause any valvular dysfunction. Alright, pop quiz. Really young kid, had strep throat about a month ago, now has a fever, heart failure, and new onset systolic murmur. That's acute rheumatic fever causing mitral regurg. How about a 40-year-old patient who has signs of left heart failure and pulmonary edema? That's weird. She's too young for heart failure. She's had this diastolic murmur for years, in fact. Uh-oh. Wait, is that an opening snap? That's chronic rheumatic heart disease causing mitral stenosis and pulmonary congestion. Seems like a lot, I know, but don't let rheumatic fever and valve disease get you all hot and bothered. Remember, look for a really young kid who had strep throat a month ago, now has fevers, heart failure, and new onset systolic murmur. That's acute rheumatic fever causing mitral regurg until proven otherwise. And just like those kids pretending to be chefs, it's molecular mimicry of strep antigens that elicits the production of antibodies that cause the damage in the first place. Want to be extra sure? Well, take a look back at all those interesting Jones criteria, or if you're still not satisfied, check anti-ASO or anti-DNase antibodies because acute infection should be long gone by now. But some antibodies persist. Sometimes that strep infection does permanent damage to the heart. Remember, those Askov macrophages can leave scars over time that sometimes lead to mitral stenosis and rheumatic heart disease instead. In that case, look for an older patient with diastolic murmur showcasing the famed opening snap. Okay, hold your horses, Your Highness, I hear you.